Kidney doctor warns this common habit is poisoning your kidneys. There's something sitting in your medicine cabinet right now that could be slowly destroying your kidneys. And the chances are high that you have used it within the last week, maybe even today. This is not some obscure supplement you have never heard of. This is not a contaminated product that made the news. This is something that hundreds of millions of people around the world reach for on a regular basis. Something that feels completely safe because it has been part of everyday life for decades. Something that does not require a prescription. Something you can buy at any grocery store, any pharmacy, any gas station. And here's what makes this so alarming. Kidney specialists see the consequences of this habit constantly. They watch people walk into clinics with declining kidney function. And when they trace back the history, this one habit appears again and again. Not in every case, but in far more cases than most people would ever expect. The problem is that almost nobody thinks twice about it. There are no warning labels that make you pause. There are no public health campaigns telling you to be careful. And because of that, millions of people are quietly damaging their kidneys year after year without ever connecting the dots. By the time you finish watching this video, you will know exactly what this habit is. You will understand why it poses such a serious risk to your kidneys. You will learn how the damage actually happens inside your body. And most importantly, you will walk away with clear, practical steps you can take to protect yourself starting today. If you care about keeping your kidneys healthy as you age, this might be one of the most important health videos you watch this year. And if you find value in what you learn here, consider subscribing to Wellness Secrets so you never miss information that could genuinely make a difference in your life. Now, let me explain why your kidneys deserve far more attention than most people give them. Kidney disease is sometimes called the silent epidemic, and that name exists for a very specific reason. Unlike a broken bone that screams at you with immediate pain, unlike a skin rash that you can see and monitor, unlike a cough or a fever that announces something is wrong, kidney damage develops quietly. It progresses in the background while you go about your daily life, feeling perfectly normal. Here's a statistic that should stop you in your tracks. Your kidneys can lose up to 40% of their function before you experience any noticeable symptoms. Some estimates put that number even higher. Think about what that means for a moment. Nearly half of your kidney capacity could be gone, and you would have no idea. You would wake up feeling fine. You would go through your day without any obvious signs. You might feel a bit more tired than usual, but who does not feel tired these days? You might notice some minor changes, but nothing that would send you rushing to a doctor. This is why so many people discover kidney problems during routine blood work for something completely unrelated. They go in for a standard checkup. They get their results back. And suddenly they are sitting across from a doctor, hearing words they never expected to hear. The conversation often sounds something like this. The doctor explains that the blood test revealed elevated creatinine levels. The estimated glomerular filtration rate, which measures how well the kidneys are filtering blood, has dropped below where it should be. There is protein showing up in the urine, which indicates the filtering units inside the kidneys are not working properly, and the patient sits there confused, trying to process this information, wondering how this is possible when they felt perfectly healthy just an hour ago. This is not rare. This is not unusual. This happens every single day in medical offices around the world. And the tragedy is that in many of these cases, the damage accumulated over years or even decades before it finally showed up on a lab report. Once kidney function is lost beyond a certain point, it does not come back. There is no medication that regenerates kidney tissue. There is no surgery that rebuilds the filtering units. The options become management, dialysis, or transplant, and none of those options are simple. This is precisely why prevention matters so much when it comes to kidney health. You cannot afford to wait until symptoms appear. You cannot afford to assume everything is fine just because you feel okay. The kidneys do not give you that luxury. They work in silence. They suffer in silence. And by the time they finally demand your attention, the window for easy intervention has often closed. Now, you might be wondering why this matters more now than it did for previous generations. After all, people have had kidneys forever. What has changed? Several things have changed, and they all point in the same concerning direction. First, we are living longer. That sounds like good news, and in many ways it is. But It also means our kidneys have to function for more years than ever before in human history. A kidney that worked fine at age 40 might start showing strain at age 60 and real problems at age 70. The longer we live, the more cumulative damage can accumulate. Second, modern life has created new stresses on the body that previous generations simply did not face to the same degree. Processed foods loaded with sodium, widespread blood pressure issues, rising rates of blood sugar problems, sedentary lifestyles that affect circulation, chronic dehydration from caffeinated beverages, and climate-controlled environments. All of these factors put additional pressure on kidneys day after day. Third, and this is directly relevant to what we are discussing today, we have become a society that reaches for quick fixes. When something hurts, we want immediate relief. When we have a headache, we take something. When our back aches, we take something. When our joints feel stiff, we take something. This impulse is understandable. Pain is unpleasant, and we have access to remedies that our grandparents could not have imagined. But that access has created a pattern that kidney specialists are now seeing play out in their patient populations. People are exposing their kidneys to certain substances far more frequently, and for far longer durations than these substances were ever intended to be used, and the kidneys are paying the price. The fourth factor is awareness, or more accurately, the lack of it. Most people know that excessive alcohol can damage the liver. Most people understand that smoking damages the lungs, but ask the average person what damages the kidneys, and you will often get vague answers. Maybe they mention drinking enough water. Maybe they mention something about salt. But the specific, everyday habits that pose real risks to kidney function remain largely unknown to the general public. This combination of factors has created what some researchers are calling a slow-motion crisis. Rates of chronic kidney disease have been climbing for years. The number of people requiring dialysis continues to grow, and a significant portion of this could be prevented if people simply understood what was putting their kidneys at risk. Which brings us to the question you have been waiting for. What exactly is this common habit that is poisoning kidneys across the world? The habit I am talking about is the regular use of a class of medications that you almost certainly have in your home right now. They go by several names, and you will recognize most of them immediately. I am talking about non-steroidal anti-inflammatory drugs, commonly called NSAIDs. This category includes ibuprofen, which you might know as Advil or Motrin. It includes naproxen, sold as Aleve. It includes aspirin when taken in higher doses for pain relief rather than the low doses sometimes recommended for heart health. And it includes numerous other formulations and generic versions that fill pharmacy shelves around the world. Now, if your first reaction is skepticism, I completely understand. These medications are everywhere. They are available without a prescription. They are recommended for everything from headaches to muscle pain to menstrual cramps to arthritis. Doctors suggest them. Pharmacists hand them out. Television commercials make them seem as harmless as drinking a glass of water. How could something so common, so accessible, so normalized possibly be damaging kidneys? This is exactly the problem. The widespread availability of these medications has created a false sense of complete safety. People assume that if something were truly dangerous, it would require a prescription. They assume that over-the-counter means risk-free. They assume that because they have taken these pills for years without obvious problems, everything must be fine. But the reality is more complicated, and the consequences are more serious than most people realize. Let me be very clear about something before we go any further. I'm not saying that these medications are poison. I am not saying that you should never take them under any circumstances. These drugs have legitimate medical uses, and when used appropriately for short periods, they help many people manage acute pain. What I am saying is that the way many people actually use these medications, frequently, for extended periods, often without adequate hydration, sometimes in combination with other risk factors, creates a pattern that kidney specialists recognize as genuinely harmful. Studies have shown that regular NSAID use is one of the leading causes of drug-induced kidney damage. Research has documented both acute kidney injury from these medications and the slower, more insidious chronic damage that develops over years of use. The medical community has known about this connection for decades, yet the message has not reached most of the people who need to hear it. Consider how many people fall into patterns of regular use without even realizing it. Someone has chronic back pain, so they take ibuprofen every morning to get through the day. Someone else has frequent headaches, so they keep a bottle of naproxen at their desk and take it whenever they feel tension building. Someone has arthritis that flares up regularly, so they use these medications multiple times per week, month after month, year after year. None of these people think of themselves as overusing medication. They are simply managing their pain in the way that feels most accessible and immediate. But from the perspective of their kidneys, this pattern of exposure creates real problems. In the next section, I am going to explain exactly how your kidneys work and why they are so vulnerable to this particular class of medications. Once you understand the mechanism, you will see why this is not about being alarmist and why the concern is grounded in basic biology that affects everyone who relies on these drugs regularly. What happens inside your kidneys when you take these common pain relievers might genuinely surprise you. To understand why NSAIDs pose such a serious threat to your kidneys, you first need to understand what your kidneys actually do and how they do it. Because once you see how intricate and sensitive this system is, the danger of these common medications will make perfect sense. Your kidneys are two bean-shaped organs, each about the size of your fist, located on either side of your spine just below your rib cage. Most people picture them as simple filters, like a coffee strainer catching grounds. But that image massively understates what they are actually responsible for. Every minute of every day, approximately 1/4 of all the blood your heart pumps flows directly to your kidneys. That is an enormous amount of blood flow for two relatively small organs. In a single day, your kidneys filter the entire volume of blood in your body, roughly 40 times over. They process about 180 liters of fluid and return approximately 178 liters of it back into circulation after cleaning it. The remaining 2 liters become urine, carrying waste products, excess minerals, and toxins out of your body. Inside each kidney, you have approximately 1 million tiny filtering units called nephrons. Each nephron is a microscopic workhorse that performs an incredibly complex series of tasks. It receives blood through a small arteriole, forces the blood through a ball of extremely delicate capillaries, where filtration occurs, then guides the filtered fluid through a winding tubule system where essential substances like glucose, sodium, and water are reabsorbed back into the bloodstream while waste products continue toward elimination. Think of it like this. Imagine 1 million tiny water treatment plants running simultaneously inside each kidney, each one making real-time decisions about what to keep and what to discard. Some nephrons specialize in handling sodium. Others focus on potassium regulation. Others manage the pH balance of your blood. Others handle calcium and phosphorus. And they all coordinate with each other and with the rest of your body to maintain the precise chemical balance your cells need to survive. This is not a passive process. It requires enormous amounts of energy. Your kidneys consume a significant portion of your body's resting energy expenditure just to maintain this filtration system. And critically, it requires a consistent, reliable supply of blood flowing through those tiny capillary beds at adequate pressure. Here is where the vulnerability lies. Those nephrons, those 1 million tiny filtering units in each kidney, are absolutely dependent on a steady flow of blood through their capillary beds. If that blood flow drops, even temporarily, those delicate structures can begin to suffer. And unlike your skin, which heals from a cut within days, or your bone, which knits back together after a fracture, nephrons have an extremely limited capacity to regenerate. When they are damaged beyond recovery, the loss is permanent. Your body actually has a built-in protection system for this, and that protection system is the exact target of NSAID medications. When your kidneys detect a drop in blood flow, they release substances called prostaglandins. You have probably heard this term before in relation to inflammation. And that is because prostaglandins are heavily involved in the inflammatory response throughout your body. But prostaglandins also serve a protective role within the kidneys that most people have never heard of. Inside the kidney, prostaglandins act as local vasodilators. That means they cause the small blood vessels within the kidney to widen, which increases blood flow and maintains adequate pressure through those critical capillary beds. When conditions threaten kidney perfusion, prostaglandins essentially open the gates wider to compensate and keep everything flowing. During dehydration, your kidneys release prostaglandins to maintain blood flow. When blood pressure drops, prostaglandins compensate. When you exercise hard and blood is being directed to your muscles, prostaglandins ensure the kidneys still receive adequate supply. When you are sleeping and your cardiovascular activity naturally slows, prostaglandins adjust the vasculature to keep the nephrons fed. This system works beautifully, and it has been keeping human kidneys functional for hundreds of thousands of years of evolution. Now, here's where NSAIDs enter the picture, and everything changes. NSAIDs work by blocking an enzyme called cyclooxygenase, commonly abbreviated as COX. This enzyme is responsible for producing prostaglandins. When you take ibuprofen for a headache, you are suppressing COX activity throughout your body, which reduces the production of prostaglandins, which decreases the inflammatory signals causing your pain, which makes your headache go away. That is how these medications provide pain relief, and for that purpose, the mechanism is effective. But here is the critical point that most people never learn. When you suppress COX and reduce prostaglandin production, you do not just reduce it in the area where you are experiencing pain, you reduce it systemically, including inside your kidneys. When the protective prostaglandins in your kidneys are suppressed, the small blood vessels can no longer dilate properly to compensate for drops in blood flow. The natural safety mechanism is shut down, and your kidneys become significantly more vulnerable to ischemic damage, meaning damage caused by insufficient blood supply. This is not a theoretical concern. This is well documented in medical literature spanning decades. The effect is direct, measurable, and dose-dependent, meaning the more frequently you use these medications, and the higher the dose, the greater the suppression of that protective system. Now, let me walk you through what this actually looks like inside your body during a typical scenario that plays out in millions of households every week. Imagine a person in their mid-30s who's been dealing with recurring lower back pain for a couple of years. Nothing severe enough to require surgery, but enough to interfere with daily life. They tried physical therapy for a few weeks, but it was inconvenient and the results were slow, so they gradually shifted to managing the pain with ibuprofen. They take 2 to 3 tablets most mornings, and sometimes another dose in the afternoon if the pain flares up. This has been their pattern for about 18 months. On most days, this person does not drink much water. They have coffee in the morning, maybe a soft drink at lunch, and perhaps a beer or two in the evening. Their actual water intake is minimal. They do not think about it because they do not feel particularly thirsty, and they have always operated this way. So what is happening inside their kidneys on a regular afternoon? Their body is mildly dehydrated. Their blood is slightly more concentrated than ideal. Their kidneys are working harder to filter the thicker fluid. In response, they would normally release prostaglandins to increase blood flow through the capillary beds and handle the extra workload. But the ibuprofen from this morning is still active in their system. COX activity is suppressed. Prostaglandin production is reduced. Those protective vasodilators that should be opening up the blood vessels are not being produced at adequate levels. The nephrons are now in a compromised state. They are being asked to do more work with less blood supply than they need. The tiny filtering units are under stress. On a single day, this is not catastrophic. The kidneys are resilient, and they can handle occasional periods of reduced perfusion, but this pattern is not happening once. It is happening almost every single day, Monday through Friday, at minimum, sometimes on weekends too when the pain does not let up. Over weeks and months, some of those nephrons begin to suffer sustained damage. The capillary beds in certain areas of the kidney develop scarring. The filtration capacity drops incrementally, and because there are 1 million nephrons in each kidney, the loss is gradual and easy to miss. The surviving nephrons compensate by increasing their workload, which masks the decline. By the time this person's kidney function shows up as abnormal on a blood test, they might have already lost a significant portion of their filtering capacity. They never felt anything wrong. There are actually 2 distinct ways that NSAIDs can damage kidneys. And understanding both is important because they operate on different timelines. The first is called acute kidney injury. This happens when NSAID use leads to a sudden, sharp drop in kidney function. It most commonly occurs during episodes of dehydration, or when NSAIDs are combined with certain other medications. Someone with the flu, for example, who is not drinking enough fluids, takes ibuprofen for body aches and a high temperature. Their kidneys are already under stress from the dehydration and the fever, and now the protective prostaglandin system is blocked by the medication. Blood flow to the kidneys plummets, and acute damage occurs within days. This is why you hear medical professionals advise people to be careful with NSAIDs when they are sick. The combination of illness, reduced fluid intake, fever, and pain medication creates a perfect storm for kidney injury. Acute kidney injury can often be reversed if it is caught quickly, and the NSAID is stopped along with aggressive rehydration. But in severe cases, particularly in older adults or those with existing kidney vulnerability, it can cause lasting damage. The second type of damage is more insidious and, frankly, more concerning from a public health perspective because it affects far more people. This is chronic NSAID nephropathy, which is the term used for long-term kidney damage resulting from ongoing NSAID use over months or years. Chronic damage develops through repeated episodes of reduced kidney perfusion that are too mild to cause noticeable symptoms, but too frequent for the kidneys to fully recover between them. Over time, cumulative ischemic injury leads to progressive scarring and loss of nephrons. The blood supply to the inner regions of the kidneys, called the medulla, becomes particularly compromised because this area already operates with relatively low oxygen levels. Research has documented cases of patients who developed chronic kidney disease, primarily attributed to years of regular NSAID use, often in people who had no other significant risk factors. Some of these individuals had been taking the medications for pain management that they considered routine and safe. The reason chronic damage is so insidious is that it does not produce warning symptoms until significant function has already been lost. You do not feel a nephron dying. You do not notice when 50,000 filtering units are quietly shutting down. The body compensates silently, and the damage progresses without any obvious signal that something is wrong. Now, if you've been watching this and starting to feel a sense of concern, let me share something that gives me genuine hope. Your kidneys are remarkably resilient. They can stabilize, and in some cases even improve their function when you remove the factors that are harming them and provide the support they need. But first, you need to know what to look for. There are warning signs that many people dismiss, attribute to something else, or simply never connect to their kidneys. The first and often earliest signal is changes in your urination patterns. This might mean going more frequently, particularly at night. It might mean urinating less often, despite normal fluid intake. It might mean urine that appears foamy, which can indicate protein leakage from damaged filtering units. It might mean urine that looks darker or more concentrated than usual, especially if you're not dehydrated. The second warning sign is unexplained fatigue. When kidneys struggle, waste products accumulate in the blood instead of being efficiently filtered out. This creates a condition where your body is essentially running with dirty fluid, and that affects your energy levels profoundly. If you find yourself feeling drained, even after adequate sleep, and there is no obvious explanation, your kidneys deserve investigation. The third sign is swelling in the feet, ankles, hands, or around the eyes. When kidneys cannot properly balance fluid, excess water accumulates in tissues. You might notice your shoes fitting tighter in the evening, or indentation marks from socks that take a long time to disappear. You might wake up with puffy eyes that do not fully resolve as the day progresses. The fourth sign involves blood pressure changes. Your kidneys and your cardiovascular system are deeply interconnected. Damaged kidneys struggle to regulate the hormones that control blood pressure, which can lead to readings that are higher than normal or increasingly difficult to manage, even with medication. The fifth sign, which is easy to overlook, is persistent lower back or flank discomfort. Your kidneys sit in that region, and while kidney pain is often described differently than muscle pain, any chronic ache in that area warrants attention, particularly if you are someone who regularly uses NSAIDs. The critical thing to understand about all of these signs is that they typically appear after considerable damage has already occurred. This is why waiting for symptoms is such a dangerous approach to kidney health. The most effective strategy is prevention, And that starts with understanding the compounding factors that make NSAID damage worse. There are several risk factors that significantly amplify the harm NSAIDs can cause to your kidneys, and many of them are extremely common in modern life. Dehydration is the single biggest amplifier. When you are even mildly dehydrated, your blood volume drops, your kidneys need prostaglandins to compensate, and NSAIDs block exactly that compensation. The combination of low fluid intake and regular NSAID use is one of the most dangerous patterns for kidney health that I can think of. If you take these medications, you should be drinking significantly more water than you think you need. Age is another factor. As you get older, your kidneys naturally lose some nephrons. It is a normal part of aging, but it means your kidneys have less reserve capacity to handle additional stress. NSAIDs that might cause minimal damage in a healthy 25-year-old can cause meaningful harm to kidneys that are already operating with reduced capacity at 55 or 65. Pre-existing conditions multiply the risk considerably. If you have diabetes, even well-managed diabetes, your kidneys are already working harder and are more vulnerable to additional insults. The same applies to high blood pressure, heart disease, or any condition that affects blood flow. People with these conditions are at substantially higher risk of kidney injury from NSAID use, and many do not realize it. Combining NSAIDs with other medications creates additional dangers. Certain blood pressure medications, called ACE inhibitors and ARBs, when taken alongside NSAIDs, create a particularly risky combination. Diuretics, commonly called water pills, compound the problem by reducing blood volume, while NSAIDs block the protective response. This triple combination of an ACE inhibitor or B, a diuretic, and an NC is well known in medicine as the nephrotoxic triad, and it has been directly linked to acute kidney injury in hospital settings. Alcohol consumption, while taking NSAIDs, increases the risk of gastrointestinal bleeding, which is the more commonly discussed danger, but it also adds to kidney stress through its dehydrating effects and its impact on blood pressure. Even exercise timing matters. Taking an NSAID before intense physical activity can increase the risk of kidney damage because exercise redirects blood flow to the muscles, reducing the supply to internal organs, including the kidneys. Without the protective prostaglandin system to compensate, the kidneys can experience significant perfusion deficits during vigorous activity. Heat exposure during summer months or in hot working environments is another amplifier. Heavy sweating leads to fluid loss, blood volume drops, and the kidneys again depend on prostaglandins to maintain adequate flow. Adding NSAIDs to this equation during hot weather is a pattern that has been linked to a surge in kidney-related emergency visits. The research on this topic is substantial and continues to grow. Large population studies have consistently found associations between regular NSAID use and increased risk of chronic kidney disease. One major analysis involving hundreds of thousands of participants found that those who used NSAIDs regularly had a notably higher likelihood of developing kidney problems compared to those who rarely or never used them. Studies have also shown that the risk increases with both dose and duration. Taking higher amounts or using these medications over longer periods produces greater kidney impact. This relationship has been replicated across multiple research groups in different countries. Importantly, research has also demonstrated that stopping NSAID use can halt the progression of kidney damage, and in some cases, function can partially recover. This means the situation is not necessarily permanent if action is taken early enough, but the window of opportunity narrows as time goes on, which is why awareness and early intervention are so important. Some researchers have pointed out that the true number of people affected by NSAID-related kidney damage is likely underreported because kidney decline in regular NSAID users is often attributed to other causes during diagnosis. This means the problem may be even larger than current statistics suggest. So, what should you do with all of this information? Let me give you a clear, practical action plan that you can start implementing today. First, reassess your relationship with NSAIDs. If you are taking them regularly, even if the doses feel small, ask yourself honestly how often and for how long this has been going on. Many people do not realize they have fallen into a pattern of near daily use because it happened gradually. Second, if you need pain management, explore alternatives. Topical options, like diclofenac gel, can provide localized relief with significantly less systemic exposure than oral medications. Acetaminophen, known as Tylenol, is gentler on kidneys than NSAIDs, though it carries its own cautions regarding liver health at high doses. Heat therapy, ice application, targeted stretching, and physical therapy have proven effective for many types of chronic pain. Massage, acupuncture, and anti-inflammatory dietary approaches can also help reduce pain naturally over time. These options may require more patience than popping a pill, but they protect your kidneys in the process. Third, if you do take NSAIDs, follow these safety guidelines. Take the lowest effective dose for the shortest possible duration. Stay well hydrated before, during, and after taking the medication. Avoid taking them on an empty stomach. Never combine them with other NSAIDs. Do not take them before intense exercise or during hot weather without adequate fluid replacement. If you are also taking blood pressure medication or diuretics, discuss the combination with your healthcare provider. Fourth, drink adequate water daily. This is perhaps the single most important protective habit for kidney health. A reasonable target for most adults is to drink your body weight in pounds divided by 2, measured in ounces, of water each day. If you weigh 160 pounds, aim for approximately 80 ounces, which is roughly 2.5 liters. Increase this if you are active, in hot weather, or taking medications that affect the kidneys. Fifth, get your kidney function tested. A simple blood test, measuring creatinine and calculating your estimated glomerular filtration rate, tells you how well your kidneys are filtering. A urine test can detect protein leakage that signals early damage. These tests are inexpensive, widely available, and can catch problems years before symptoms appear. If you are over 40, if you have been using NSAIDs regularly, if you have diabetes or high blood pressure, or if you have a family history of kidney disease, this testing should be part of your routine health monitoring. Sixth, protect your kidneys through daily habits that support their function. Eat a balanced diet rich in vegetables, fruits, lean proteins, and whole grains. Limit sodium intake to reduce the workload on your kidneys. Maintain healthy blood sugar levels. Keep your blood pressure in a healthy range. Avoid excessive alcohol. Get regular physical activity. Prioritize sleep, because your kidneys perform important repair and regulation work during rest. These are not dramatic interventions, but they create the conditions your kidneys need to function optimally for decades. I want to close with something important. You are not at fault if you have been taking NSAIDs regularly without knowing the risks. This information has not been widely communicated to the public in a way that reaches people where they are. You made the best decisions you could with the information you had available, but now you have this information, and what you do with it from this point forward is what matters. Your kidneys work relentlessly for you. They filter your blood, balance your minerals, regulate your blood pressure, produce essential hormones, and maintain the chemical environment your cells depend on every second of every day. They ask for very little in return: adequate hydration, freedom from unnecessary chemical insults, some basic support through the habits you maintain. If you take nothing else from this video, let it be this one simple shift. Think twice before reaching for that pill bottle. Ask yourself whether the pain truly requires medication right now, or whether there is another approach that could work just as well. And if you do take an NSAID, treat your kidneys kindly by drinking plenty of water and not making it a daily habit. If this information was valuable to you, please share it with someone who might benefit: a parent, a partner, a friend, anyone who regularly uses pain medication without thinking about the long-term impact. That one conversation could genuinely change the course of their health. Subscribe to Wellness Secrets, science-backed information that helps you protect your health in ways that actually make sense. Hit the like button so this video reaches more people who need to hear it. And drop a comment below if any of this resonated with you. I read every comment, and hearing from you helps me create content that matters. Your kidneys are counting on you. Take care of yourself and take care of each other.